what I was going to suggest is that I'll just pick 2 questions that have come up and have been sent in by people listening online. I'll let you know about those, and then you can perhaps respond to what Nick has said, because he had some specific questions, and also what Angela has said. So a couple of questions that have come in online. One from Tom Newmark, who's a PhD student at the University of Cambridge. He says he hasn't heard anything about conditionality in regards to social protection and wonders whether you can say anything about what the ILO's stance is. And then the second one is from Stefan Ortiz, who's a campaigns assistant for Oxfam International in Brussels, who's thinking about refugee communities and asking whether the SPF recommends social protection for citizens or for residents. And one of the things that I'd like to flag is that there are questions that may be more or less sensitive for Michael. If there's anything that you don't want to answer, or anything that you know that it's not appropriate for you to answer at this moment, then that's fine. You respond to the questions that you want to.
Well, there's nothing that one shouldn't answer. There's something that may not be wise to answer at this point in time, you know. But let me try to get to the last 2 first. So first of all, conditionality is part of the flexibility. I mean, we would simply saying there should be income security. That means if you are in a certain condition and that you're lacking income, somebody will provide you with an income that enables you to have access to the essential goods and services. If a country decides that is a conditional benefit, like the Bolsa Familia, or you have a universal pension, like in Namibia, that for us is open and is up to the national decision. It's what I'm saying. There's flexibility in benefits and there's flexibility in schemes. I personally don't like conditional benefits too much because I don't think they add much to what we can achieve. But we can also see that there is some, especially the health conditions in some countries, work. Then the residents, well, it's certainly not citizens. But I need to explain, I think, at this point, what the process is that we're going through. And I've said that, and Nick hasn't heard it, so that, because otherwise one of his questions wouldn't have come up, or one of his observations wouldn't come up. So what we do is we send out questionnaires to our country, to our member states, and to the employers and worker members of the ILO and say, look, what do you think about the following clause, providing the following guarantees to all residents? And then you get 100 answers from countries. Some of them agitated, most of them from the government, saying, look, we have our own definition of residence in our country. Who are you to tell us? We had this fight in all sorts of other international bodies. We don't want it on social protection. Then there's countries from a region, particular region of the world, that said, in our case, it's citizens, because we have 1/3 of our labor force from outside. We don't think they should be having the same benefits. So in the end, the question, the idea was to say we are putting residents down, but with the qualification that has to be defined in national law. It's not ideal. We would like to have it for everybody in a territory, but it's something that would kill the instrument if we were to debate it, because it has not been solved in other fora. We won't solve it here. So there's a choice, a political choice that you have to make. And we would just follow what our constituents say and try to build a compromise that is still meaningful. I think we found that. Then let me respond to Nick. Well, first of all, it's nice of you that you are using our slides, but these are the ones that actually prove that an organization, even if it's more than 90 years old, can learn. Right? So if you use the slides that I would have presented, had Rachel let me, because this is a much more preferred. By the way, it's much easier to give a PowerPoint presentation and talk as long as you want, and don't let her come in with a question, than doing this thing here. So, but we now have a specific, and we said that there's a clear definition between the guarantees and the benefits and the schemes, and that's the maximum that we could achieve, and it's also the maximum that I think now is reasonable. So yes, we started out with saying there should be a universal pension for everybody. That's actually how the thing was costed, because it's the easiest way to cost it. But we recognize that this is impossible to get through the international process, because countries will not dismantle what they have already if it provides the income security that is needed. Well, then the process, my favorite subject is evidence. No. The other thing was, how can you be so, was it arrogant to say?
No, he didn't say arrogant.
No, he said arrogated, and this is a term that, and this is not my native language, so I don't quite understand it. But
I think it means that he's kind of over-representing.
Yeah, but basically, I'm sorry. The Bolsa Familia is part of a social flaw, as it is defined by the international community. The name came beyond the fact. Otherwise, social assistance for the unemployed, unemployment benefits, which is part of our income security possible mechanism for people in active age. How can you tell us you can't use that? But this is the only instrument we have, right? So together with NREGA. So yes, we are incorporating, we're building, we're saying, yes, there are systems. It's the strength of the concept that you're saying, you're doing this already. All we want is build a complete set and a logic around it. Evidence. I'm a mathematician, so evidence for me comes after proof, because evidence is a substitute for proof, right? First of all the systems that we, as you say, that we have genuinely incorporated into our thing have their own evidence. So the evidence is there. So let's put this aside. But there's a much more fundamental element to this. Social protections worked in all countries that today are industrialized countries and relatively successful in their standard of living. It's reducing poverty and inequality by at least 50% in all of these countries. So what is it that we need in terms of evidence? There's one thing. We know from the elements that we have incorporated so generously into the concept, we know from the long 120-year history, 130 years of history of social protection systems, we know from the Friendly Society in the UK before that they work. So what more evidence? But then the logic. How can somebody possibly deny that a child cannot become a productive member of the workforce if it's stunted, if it's not educated, if it suffers from malnutrition and the long-term effects of that? What evidence do you need that we need to invest there? What evidence do you need that a grandmother dies earlier if she doesn't have a pension? As I said, as a mathematician, evidence comes after proof, and logic is 100% substitution for evidence. And what I do object to is that people are saying you don't have the evidence, and they're buying time. And this is what's happening at the moment. Whenever I go around and I say, well, where's the evidence? And it's all early days. The evidence on universal pensions is in early days. There's just no need to say we need to research this to the end of the decade, and then we start carefully thinking about a process. Evidence has become a synonym for delaying the process. I'm not saying there shouldn't be. We should do things where there's no evidence, but we should call a halt at some point. And before we did this, Nick, we actually went through all the national processes on cash transfers where we have any evidence. And that was done in 2010. There was not a project in a program in the world that we could find any possible evidence on that we didn't look at and said, what is the outcome of this? So I do think we did our homework. I do think some of the elements need more homework on conditional cash transfers in particular. But as it is one element out of options, it shouldn't delay the process for getting this through. Let me give a policy message on this, because a political message on this, because I'm not sure that you give me the chance to do this again. The window is closing also. We do this now. This is it came out of the biggest push to this came through the crisis. In a world that looks for austerity measures, the case for social protection gets weaker by the day. So that's why we want this on now, through today, this summer.
Thank you. I'm going to go open the floor here in London for questions now. If you have a question, you raise your hand, and when you ask your question, please can you tell us who you are and where you work? That would be really helpful. Okay, any hands? There's a lady here, and then Koi, and then Joe, and then this lady here, and we'll take 4 at a time.
Thank you very much. Idil Mohammed. I'm a postgrad student at the London School of Economics. You mentioned that you don't push, you can't, and I very much understand the fact that you cannot push the national governments to implement the social protection for, and that's very understandable. And you also mentioned where we might go from here. And this is just drawing in what Angela was saying about the role of civil society. I was wondering whether the ILO, as an international organization, does something to deal with civil society, to create that policy space, or does it only rely on INGOs like Angela's? Thank you.
Okay, thanks. Can you, just to this lady here, will you take the microphone?
I'm Rupinder. I'm a master's student at the Institute of Development Studies here in UK. My question is more specific to countries like India or Brazil. And the question is that countries like India might, the way I'm understanding it, if it's the national governments who will sign up a commitment to either having a social protection floor or building a social protection floor, countries like India might qualify for having a social protection floor given the range of schemes and programs that they have today in all these categories. But my question really is, would them signing up to this commitment change anything in the effectiveness of the programs that they have on ground, which are to a large extent underpinned by rights, have a universal coverage in some elements, yet don't deliver on ground for various reasons? And will it change anything for them, even if they tick the box of having a social protection floor?
Thank you. Koi?
I'm Coy Thompson. I'm chair of the Grow Up Free from Poverty Coalition. I'm also chief executive for Children Crisis. I was just wondering, Michael, actually, in an age where there has to be an army of experts between development assistance and the poor, and a whole crowd of institutions and experts and everything else like that, do you think to some extent people are not trusting of the poor to do with money as they choose, and that's an issue? There's a self-interested thing there. And that's basically the question. And also, I want to hear a little bit more about this window of opportunity, because I find that very alarming, actually, what you're saying. We've got a month, basically, in which to push this agenda forward. Do you think people realise that window of opportunity is so small? And do you think it's time for those interested in social protection to really lay aside some of the kind of interesting debates for a little while and put their weight behind this initiative?
And then Joe.
I'm Joe Hanlon. I wrote a book called Just Give Money to the Poor. And one of the conclusions that came out of that was that cash transfers are intensely political, and that where they work because they have domestic political buy-in. And that you start small, you get buy-in, and sometimes it's a child benefit, sometimes it's a pension. It can be a huge number of things, and therefore the flexibility that we've been talking about is really important, because you have to get domestic buy-in to start. Once you start with something, of course, it becomes hugely popular and it becomes a political thing to expand it. So this is really a comment more than anything else to say that the key issue is not international and is domestic. And everything that has been imposed from outside to meet somebody else's standard World Bank, American Development Bank, all of these things who try to impose systems, DFID, they all fail. And it's only where it has political, domestic buy-in that they succeed. And I think that's where the initiative has to be. How do you build the political base locally?
Would you like to respond?
Yeah, I obviously have no issue with Joe on this. Basically, as I said, 2 or 3 times, the critical phase now is to build a national policy space, and it can only come through the national decision-making process. And one of the most successful example is the child grant in South Africa, which grew because it was considered so hugely successful in a particular political situation, one has to say. But that's it. Then let me go through, what do we do for civil society? The ILO is a tripartite organization. So our part of civil society usually was always the workers, right? So we're slowly extending our work with other elements of civil society. What we do concretely on this one is we would make available the complete methodology, what we call a rapid assessment protocol, that you could go to a country, and it also answers some of the other questions, and say there is a logical framework by which you assess to what extent a country has a complete social flaw, what it would cost to fill the gaps, right? So that thing, and we will try to roll out that training process to as many people as possible so it can be used by civil society. So you don't have to reinvent the wheel, but the methodology is there, right? And if you all use the same protocol in assessing it, it has a beauty because you can benchmark yourself against somebody else who has a much higher level of GDP per capita, whose policy space may be much bigger than your own, right? So if you go to a country X, and I see that at the same level of GDP, which you see today, that even at a level of $3,000 per capita GDP, you have social expenditure ratios that are up to 10% points of GDP different because the policy space is different, right? So we can give you that to make these kind of arguments. You can support it in a number of countries, but not in all, technically. And you first have to make a technical case. I'm sorry, what all I've said about evidence, but you have to build a case on a strength of figures. And it actually, what actually broke the spell of the long-term stalemate in social protection policy globally was that we put the figures down, that the actuaries of the ILO said, you can afford it. It's not too expensive. So this is where we can help. What India does, it has major elements of the social protection flow on the book, right? So if we would do that protocol, we would say there is these NREGA, there is in a number of states a fairly good universal pension system. There is a major effort to reach out to the 300 million people who have no health coverage. We would find out the same in China, by the way. And we would say we would use the floor, if you want, as a diagnostic benchmark, which would look at 2 things, not just the legal side, but also the effective side. So we would look, first of all, at the law, saying everything looks fine. And then we would go to the countries, to the counties, or down to the institutions that are actually organizing on a community level the NREGA program, and see how many people that are eligible are actually getting it. So there's 2 levels of the one is the theoretical, the legal aspect, and one is and I think we should, and our protocols actually allow for that difference. And then you have a gap in the financing, which is one is theoretical, saying you're almost there, and the one is practical, saying, yeah, you're legally there, but you're not practically there. But that's as much as we can do. What we also can do, which we haven't told anybody, we can ask our member state to report on the implementation of this at regular interval. They don't like to do that because it's work. But we have the institutional and constitutional right to do it. We haven't told them that we will, right? Koi, is this the time to show your weight? I think it is. It shouldn't be the end of the debate, because I think basically we need to see how we keep this alive after this. For me, the next 4 weeks are crucial. One wrong move, right, that becomes too prescriptive on one hand, could derail the process. And at the same time, one move to make it even less prescriptive than it is now may make it meaningless, right? So if you in the end it becomes a declaration of intent, we're all brothers and sisters and we should have some social protection, then for God's sake, let's forget it, right? So it's a very critical time for us to keep that balance, and that's one of the reasons why I wasn't entirely happy when Rachel said I want an open-ended question and answer session, because we want to be careful and not to spill the beans here. And, so we have time for more, right?
Yeah, we've probably got time for one more round. Lady at the back there, and then Sylvia, and sorry, I don't know your name, and then I've. Okay.
Okay. Hi, thank you very much. It has been extremely interesting. Well, my name is Mariela Cichon. I work for an organization called Development Initiatives, and we work on development finance, basically. My question is on development finance. We have been talking about fiscal space at national level, and I was wondering if there has been some thought about engaging on using other financial flows, for example, private flows at domestic and international level, and not just I'm not just talking about official development assistance, but all kind of financial flows that could promote or not necessarily promote this process. And also probably comment on this if you think it would be a positive or a not so positive engagement. Thank you.
Okay, thanks. Can we keep the question short? I'm just going to add to the one that's just been asked. There's also a question online which says, what about the contribution or role of the private sector, and what about private insurers, particularly in microfinance for the poor and vulnerable in India? That's from Jyotiraj, Concern Worldwide in India. Sylvia.
Okay, Sylvia, HelpAge International. It's really, it goes back to this sort of issue that Nick raised about marketing, about what is and what isn't the floor, and how the sort of assumption that being an idea that's proposed by the United Nations through its agencies or through its CEB or whatever is an imposition. And how we get over that issue. I mean, for example, Angela raised the Windhoek, Livingston 1 and 2 process. As you know, we were very involved with that, and we, worked together to come up with governments across Africa with a formulation which was called minimum package. It's exactly the same as the floor. So what is the connection now in the marketing idea, if you like, so that African governments don't feel they're being told to do something different, that actually what they've already agreed is being taken forward in a month's time? How do we sort of together connect all these things up so that the marketing is correct? Thank you.
Just behind you.
Thank you. Hi, my name's John. I'm a master's student at the School of Oriental and African Studies, and I think my question relates to, I think, one that's just been asked on the internet. And as you've pointed out, Michael, thank you very much for your talk, by the way. The ILO is a tripartite organisation, and I just wondered what the role of the third party is in the extension of the social protection floor, and how it relates to kind of employers' commitments under the decent work agenda more broadly.
Okay, Michael? We've got 2 minutes left.
Yeah. Well, so first of all, the employers are concerned about that this creates tax burden that they ultimately have to bear, right? So they have all the sustainability provisos that are in there, they're brought in, but they're supportive, and on the whole, 2/3 of them roughly supported what we suggested, which we never had on a transfer question from the employers. And the argument that you say, if you don't invest, if the country doesn't invest in your labor force, making sure that people are becoming employable, you will never, your growth will hit a barrier at some point. They bought that. They're concerned about the fiscal implications, and they will come up with that argument. But they're not antagonistic as they were in the beginning of the process 10 years ago. So there's a major, we moved up the learning curve. We have taken some of their preoccupations on board. We know that we can't set up systems that overpromise and are not sustainable. We have our own views on sustainability, but we take they're actually perceived as part of the decent work agenda that they have subscribed to. At least I have not seen yet to this moment more opposition than I don't know how long that will last, but I think we will. So they're not the biggest friends, but they're not, at least not objecting. Well, Sylvia, with the SPFs are identical. You know that. So, and we told that to the AU. What more can we do? If they call it differently, there's no problem with us, right? So it's a way to say where's the ownership and what came first, and we have acknowledged that. And they actually are all committed in Yaoundé to our version of this as well. But they make a clear link to the Windhoek decision. So I don't think there's any problem with this. It's just that one is an African thing, and we can't export the African context to the rest of the world as we can't export a European to the rest of the world. Then. What about the role of the private sector, and what I thought that was a question for international financing, right? This is one of the ones that I'd like to pass, but because this is very. So one thing is very clear: you cannot build a social protection system with long-term transfers north-south. It's an endogenous financing system, has to be endogenously financed, and the success that we will have will depend on the fact that we can convince all the governments, or most of them, that they can do this. It's not very difficult to convince a government that they have to implement a system, but they will get financing from the UK or somewhere else, then you can sell that tomorrow. And we have donor dependency in some of the health sectors up to 60% already of their budgets. That's not sustainable in the long run. We want them to be, and we want that to be endogenous financing, and it's the only thing that I think in the long run will sustain these things. And it's much harder sell than saying the international community should help whenever they can. Having said that, we only need 0.5% of global GDP to come up with a real credible social assistance minimum scheme around the world. We probably need another half to build the logistics and the delivery mechanism, right? So it's something that the world should know and should think about, and how much of our ODA should go there is something that we need to discuss. There's a plea here from the G20 and from the Bachelet group that helped us on the UN system to say there should be a greater focus of the international donors on building the elements of the floor that are not existing yet. But not calling it floor, but if you call it, it's a family, a child benefit system, that's fine as long as it meets the criteria there. So what the floor really is, Rachel, is it's a benchmark, a system of benchmarks for national systems. It's not prescribing a benefit, it's not prescribing a system. It's saying these are the level that you should meet at least at a minimum. in development. I don't see any tension between the national and the international level, but I don't think that you can do this, push this policy-wise on the global agenda without having an international mandate.
Okay, I think we'll call that the last word. Michael, thanks very much. The one thing that I want to say when we're wrapping up is that Michael's been brilliant today, because we don't usually run our meetings in this kind of format. We don't usually do this interview thing. We decided to give it a go, and he's been a really brilliant guinea pig. So thank you so much for that. We'll have a round of applause in the moment. The one final thing that I want to say is that you always get a feedback form from ODI asking you about the meeting, how good was it, and so on. Because of the new format, it's really, really important for us to get your views on whether this worked or not. And it's difficult sitting here to know whether it did or not. So please fill in your feedback form, even if it's only this time that you do it. So, all right, very last word.
Rachel was a bit concerned about the question and answer thing, because we didn't agree on questions and answers before, right? What she didn't know is that she would get the answers from me regardless of the questions that she
You can let me know if you think that's true or not. We'll see. Okay, so thanks everybody. Maybe we can finish with a round of applause for Michael. Thank you.